Hello everyone and welcome. In today's comprehensive lecture, we are going to delve into the world of computer tomography or CT scans. This vital medical imaging technique provides detailed views of the inside of the body. We will explore the principles, process, applications, and important considerations. So let's get started. Let's begin with the basics. Computed tomography or CT uses X-rays and computer processing to create detailed cross-sectional images of the body. These slices provide much more information than a traditional X-ray. Compared to conventional radiography, CT scans offer several advantages. A key one is the elimination of superimposition. In a regular X-ray, all structures are overlaid on each other, making it hard to see details. CT overcomes this. CT also has superior contrast resolution, allowing us to distinguish between tissues with only slight differences in density. The development of CT was a major breakthrough. In the 1970s, Godfrey Hounsfield and Alan Cormack made key contributions, leading to the first clinical CT scanner in 1972. Their work was recognized with the Nobel Prize in 1979. The basic principle involves an X-ray source and detectors rotating around the patient, acquiring multiple projections. Different tissues attenuate or absorb the X-rays to varying degrees. This differential attenuation is the key. A computer then reconstructs these measurements into detailed images. Now let's discuss some of the physics behind CT. X-ray attenuation is a fundamental concept. As X-rays pass through matter, their intensity decreases. How much they decrease depends on the energy of the X-ray photons and the properties of the material, especially its density and atomic number. The linear attenuation coefficient mu quantifies this. To make sense of the image data, we use Hounsfield units or HU. This is a standardized scale where water is 0 HU, air is minus 1000 HU, and dense bone is around plus 1000 HU. HU values allows us to objectively differentiate between different types of tissues. The raw data from the detectors is not a directly viewable image. It needs to be processed using complex algorithms. Early CT used filtered back projection. Modern CT scanners use more advanced iterative constructive techniques, which produces higher quality images with less noise and artifacts. Let's look at the components of a CT scanner. The gantry is the large ring-shaped structure. It houses the X-ray tube and detector array. It also contains slip rings, which allow continuous rotation of the X-ray tube. The X-ray tube produces the X-rays. It rotates rapidly around the patient during the scan and must be able to handle a lot of heat. The detector array measures the intensity of the X-rays that pass through the patient. There are different types, including scintillation detectors and solid state detectors. The number of detectors rows is important as it determines how many slices we can acquire with each rotation of the tube. More rows means faster scanning. The patient table is a motorized table that moves the patient through the gantry with very precise positioning. Finally, the computer system is crucial. It acquires the data from the detectors, processes it to reconstruct the images, and then stores and displays those images. Now let's walk through the CT scan procedure itself. First is patient preparation. The patient's medical history is reviewed and the procedure is explained. Patients need to be remove any metal objects like jewelry. If contrast is used, they might need to fast. Contrast agents which help highlight specific structures can be given orally, intravenously, or rectally, depending on what we are imagining. During the scan, the patient lies on the table and the body part being examined is carefully centered within the gantry. During scan acquisition, the table moves and the X-ray tube rotates. Patients may be asked to hold their breath briefly. The scan duration can vary. Finally, the computer processes the data to create the cross-sectional images. These are viewed on a monitor and a radiologist interprets them. There are several types of CT scans, each tailored to specific body regions. A head CT is used for the brain, sinuses, and orbits and helps in diagnosing stroke, trauma, and tumors. A chest CT visualizes the lungs and mediastinum and is used for conditions like pneumonia, pulmonary embolism, and lung cancer. An abdominal or pelvic CT examines organs like the liver, kidneys, and bowel and is useful for diagnosis appendicitis, kidney stones, and tumors. CT angiography or CTA focuses on blood vessels. It requires IV contrast and helps diagnose aneurysm and stenosis, means narrowing of vessels. Finally, a spine CT looks at a vertebrae and discs and is used for things like fractures and herniated discs. CT scan have a wide range of clinical applications. They are essential for diagnosing, helping to identify infections, tumors, trauma, and vascular diseases. CT is crucial in staging of disease, particularly for determining the extent of cancer. They are also used in the treatment of planning, such as for radiation therapy, where precise tumor location is needed, and for surgical planning. CT can guide procedures like biopsies, where a sample of tissues is taken, and drainage procedures. In some cases, CT is used for screening, such as low dose CT for the lung cancer in high risk of individuals. Like all medical tests, CT scans have advantages and disadvantages. Advantages include fast scan times, high spatial resolution, meaning detailed images, wide availability, and a relatively low cost compared to other advanced imaging. Also, CT scans are less sensitive to patient motion than MRI. However, there are disadvantages. The use of ionizing radiation carries a small increased risk of cancer. Some patients may have reactions to the contrast agents. And while CT is excellent for bony detail and many soft tissues, it has limited soft tissue contrast compared to MRI. A key consideration with CT scans is radiation dose and safety. The effective dose is measured in sieverts or SB, or more commonly millisieverts or MSV, and it varies depending on the body part scanned. We always follow the ELRA principle, as low as reasonably achievable, to minimize the radiation exposure. It's crucial to balance the risk versus the benefit. The medical benefit of the information from the CT scan should outweigh the small potential risk from the radiation. Each CT scan should be justified. There are techniques to reduce dose, including low dose CT protocols, shielding the patient, and care selection of the scanning parameters. Interpreting CT images requiring skills. anatomical knowledge is essential for identifying normal structures. Radiologists must also be able to recognize pathology or abnormalities. Windowing is a crucial technique. It involves adjusting the brightness and contrast of the image to optimize the visualization of specific tissues. We adjust the window height and window level. A systematic approach is vital for reviewing the image to ensure nothing is missed. The field of CT is constantly evolving. Multi-detector CT or MDCT has greatly increased scanning speed and improved resolution. Dual energy CT allows us to differentiate tissues based on their composition. Photon counting CT is a newer technology with the potential for even better image quality and lower radiation dose. And artificial intelligence or AI is playing an increased role both in improving image reconstruction and in image analysis also. In conclusion, CT is a powerful and versatile imaging tool. It provides detailed anatomical information and is essential for diagnosis, treatment, and planning, and also guiding medical procedures. While radiation dose is an important consideration, technological advancements continue to improve CT imaging, making it safer and more effective. Thank you for watching.